Yes, yes. So any doubts, I think we can discuss in coffee break. There is no time. We have to have our director sir is waiting. We'll have a inauguration. Please wait. Stay back. We'll have inauguration for 5 minutes and followed by a tea break. We'll take 5 minutes to the
Our beloved head of department, Dr. Swarnalata madam, please grace the stage now. I request Dr. Gangadhar sir, Professor, Head of the Unit, Science Instrument, Dr. Urmila madam. Professor Dr. Gangadhar sir. I request all the dignitaries to come together for lighting the lamp.
And nephrologist, immunologist, I don't know who else are there in this hall. And very interesting, the nephrologist learning immunology or immunologist learning a nephrology, I do not know. But it seems to be both groups are learning immunology, and I did not understand the ABC of all these things. I am a liver surgeon. After doing a liver transplant, we don't bother much about immunology. We bother about hepatic artery, portal vein, and how the liver is functioning, and very little about immunosuppression. Well, we had, I remember post-renal transplant, 2 interesting cases. Apart from, we get a call from our nephrologist, very active department in Nizam Institute of Medical Sciences. So we get calls from them for fungal infections and fungal abscesses. But 2 cases we had very interesting, and both of them present with massive GA bleed. And one patient is in a VIP, post-renal transplant and immunotherapy, and had a massive upper GA bleed. We were actually trying to manage conservatively because in a high-risk patient and of course VIP patient is a member of the Legislative Assembly. You can understand tackling or operating on a VIP and post-transplant and immunosuppressive therapy. These patients will have a lot of complications after surgery. So hence we were, managing conservatively. But at one point, we were forced to go and do a surgery. And after opening the abdomen, I saw that the entire stomach was black, and did a total gastrectomy and reconstruction. The biopsy report was mucormycosis. It was somewhere in 1990. And we bought lyophilized amphotericin B from America. It was costing 3 lakhs plus per dose. So luckily he survived and went home. And another patient had a lower GI bleed, and colonoscopy did not show any lesion anywhere. And we did an angiogram which showed a pseudoaneurysm of middle colic artery. So, and we did a colonic resection and excision of the aneurysm. Those were the 2 interesting cases operated by me post-renal transplant. So I really congratulate the Department of Nephrology in Hyderabad, Nephrology Society to conduct this kind of workshop. Thank you very much for giving me this opportunity. Thank you.
I request Dr. Swarnalata madam to.
Very good morning to all of you, dignitaries on the dais and off the dais. As you all know, the number of transplants are increasing across India, not only in private sector but also in the public sector. And in the nephrology department at Nizam's Medical Sciences, we are doing more than 100 transplants a year. But as you all know, there is a lack of resources, and we are only stuck with few of the immunological tests available with us. So there's a lot of complications happening, and there's a lot of because of availability of the technology or available technology, we have the availability of the immunological tests which are not being used appropriately, or I can say not being for the patient benefit. So I think this was a forum to look into all the tests which are available, which can be appropriately used, and to optimize the immunosuppression medications and improve the outcomes. So that was a reason for selecting this topic. And as you all know, this transplant immunology workshop has been happening across India in various forums. So when I last met in MMM in Chennai, I thought we had a very, I can say expert group. So I thought we can mobilize this expert group and take it to this program to Hyderabad. And that's how we have all here gathered here to learn about the transplant immunology. And I thank all the speakers who have come all the way across India, and particularly on Sunday, sparing your valuable time and enriching us about the transplant immunology. And hope after this program, all the students and then the practitioners will have some knowledge about how to use all these tests which are available for the better patient outcomes. And I thank our director for supporting us in all the academic programs and allowing us to host this program here. Sir has been very dynamic. We know he is a surgeon now, so you might be knowing how good clinician, physician, and clinician, surgeon, and academician. And now he's become a good administrator. So we can see drastic changes in the various reforms which sir is bringing in our institute. Thank you, sir. Thank you for supporting us. And Hyderabad Nephrology Forum has been very dynamic. So we have a lot of verticals in this. We have this academic, very good academic vertical, which is headed by Dr. Manisha. She's not here. And we have monthly academic activities, we have workshops, we have webinars, we have seminars, and we have a very active program going on. And thanks to all the seniors who have been guiding us, Dr. Angada Madam, Dr. Dakshamurthy sir, Pradeep Deshpande sir, and Girish Narayan sir have been advising us and supporting us. And we have this, the newsletters also, we'll be releasing it soon now. And we have all other verticals like patient advocacy, we have the Twitter, and we have the examination, the cell, and we have research. So we have so many verticals which is happening, it's very dynamic. And not last and not the least, we have this women forum also here. Dr. Vimla Madam is that the reason, Madam, we have called you on stage is a part of this program. Women in nephrology also, we are trying to be associated with this. So we are happy to host this program. I'm sure after this program, everybody will be enriched with enough knowledge to lead their patients in a better way for the better outcome of the patients. Thank you.